My name is Ali Savage. I work in the communications team at Telethon Kids Institute. I'd like to acknowledge that we're on Noongar Whadjuk Budja and pay my respects to elders past, present and emerging, and to thank them for their generosity and wisdom in all the work we do here at Telethon Kids Institute. We're thrilled today to be joined by two of WA's leading infectious disease expert paediatricians. Professor Peter Richmond is the head of the Vaccine Trials Group at the Wesfarmers Centre for Vaccines and Infectious Disease at Telethon Kids Institute. He's also a professor at the University of Western Australia and an immunologist and paediatrician at Perth Children's Hospital. Hi, Peter.
Hi, Ali. Thanks for having me.
And Associate Professor Asha Bowen is a program head at the Wesfarmers Centre for Vaccines and Infectious Disease at Telethon Kids Institute, and she is also an infectious disease paediatrician at Perth Children's Hospital. Hi, Asha.
Hi, thanks for having me.
Okay, so we're going to get straight into your questions now. We've had a lot of questions coming through in the past couple of days, and we'll continue to take some live questions as they come through. The first one that we've had from a lot of parents has been about different medical conditions and disabilities that their kids have and whether the vaccine is safe for them. So things like heart defects, Crohn's disease, diabetes, asthma, cystic fibrosis, that sort of thing. So Peter, we'll start with you. Are there any medical conditions or any children out there in the community who should not be having the vaccine?
Thanks, Ali. So this is really important because it's exactly those children who are most at risk of getting complications from COVID and ending up in hospital. And I'm pleased to say that with these vaccines, the other medical conditions they have are not contraindications to getting vaccinated. In fact, for the age group for which the vaccine's licensed for, it's really should be given to every child. The only exception for that is where they've had a severe allergic reaction to one of the components of the vaccine or the first dose of the vaccine, in which case we would have to choose another vaccine. So really good news. It's been shown to be safe and effective in all the children that it's been studied within these age groups.
And Asha, I'll just ask you, can you tell us a bit about what we know from overseas and indeed in the eastern states about whether or not children who have other conditions, medical conditions or disabilities, what sort of outcomes they're getting when they do catch COVID-19? So what the risk is for them in catching COVID-19?
So those are great questions, and we know that whilst COVID is a relatively mild illness in children, some children can get very sick. And we know that children who have some underlying medical conditions are in the more likely group of children to get more sick and need hospital level care. So some of those, studies overseas have shown that children who have, neurodisabilities, who have immune compromised, their system is not as able to fight infections, and a few other conditions are putting those children at a slightly higher risk. Things such as obesity and asthma, when they're severe, can mean that children are more likely to get into hospital. But we also know from lots and lots of studies, as well as experience in the hospital system, that those children are very well cared for, that we have the systems in place for them, and the vast majority of them will have a short stay in hospital and be able to be discharged quickly.
That's good to hear. Okay, so Jamie Lee on Facebook has asked, what do we know about the long-term effects of the COVID vaccine in kids? Peter, I'll ask you that question.
Thank you. So obviously with the pandemic, it's a short period of time from when the vaccines have been developed and rolled out. We've now been studying COVID vaccines in children for about 12 months. So we do have a long-term information up to that point, but the good news is that there hasn't been any long-term side effects that have been attributed to vaccines, and that's what we'd expect. Generally with vaccines, if you are going to get any side effects, it's really in those first few days or maybe up to a few weeks after the vaccination. After that, if you're okay, then you're not going to get any long-term side effects. So I think we can be really reassured. And we now know that these vaccines have been given to millions of children. 5 to 11-year-olds have already had 10 million children in the United States who've had the vaccines, who've had a lot of detailed safety follow-up. And the good news is that there's no unexpected side effects that we've seen. And in fact, that age group seems to have less side effects than older teenagers and young adults.
Explain it before, Peter, about the mechanism of delivering vaccines to the body. It goes into the arm and there's very little chance of it, or no chance of it going to other parts of the body. Can you just explain that a little bit as well?
Yeah, that's right. So what we're trying to do when we give a vaccine is to not have any of the risk of infection, but to give one of the important parts of that virus show it to the immune system so it can develop those antibodies. And when you get the injection, what happens is that the mRNA from the vaccine makes the protein, the spike protein in the muscle, and shows it to the immune system, and it also activates the immune system to say, this is not something we've seen before, we need to fight it and make antibodies. And that's why we do tend to get a bit of a fever, a bit of a sore arm, and there are all signs that the immune system is switching on and is starting to make protective antibodies.
Great. The next question is from Sarah Adams on Facebook, who's asked, would you get your children vaccinated? Asha, that's one for you.
So my children are 9 and 10, so they're right in the middle of that 5 to 11-year-old period of vaccines that have just become available in the last few weeks. And so my children are booked in to have their vaccine, and I think it's a really important vaccine for them to be having at this time with a pandemic occurring.
Marika Sumik on Facebook has asked about the Novavax vaccine. Would this be better for young kids, Peter, when it does become available in Australia? And how is Novavax different from Pfizer?
So first of all, what's the difference? So Novavax is a vaccine that's made a bit more like our traditional vaccine. So it's actually giving the protein rather than relying on the body to make it, which is what happens with the mRNA vaccines. But it also has an adjuvant to improve the immune response to that, which again kickstarts the immune system to action, so is associated with some more side effects. For Novavax though, the studies in children are pretty limited at the moment. They are ongoing, but we haven't seen that information. So my advice would be not to delay and wait for the Novavax vaccine, but to actually give the mRNA vaccine that we have confidence in, that has been studied in children, has been given to a very large number of children, and has been shown to be safe and also shown to be effective.
Great. Casey Summers on Facebook has asked a question about vaccine safety. Asha, I'll put this one to you. How do we know the benefit of vaccinating kids? Sorry, I've misread that one. Cassie Townsend Smith has asked about myocarditis and pericarditis. Is there an increased risk of this with the Pfizer vaccine, as has been seen in some adults who've received it?
That's a great question. And once again, if I divide the 5 to 11-year-olds and the over 12-year-olds into two separate groups of children and adolescents, so the children aged 5 to 11-year-olds, there has not been a signal that there's increased chance of heart problems, including pericarditis or myocarditis. We're obviously watching for that very, very closely, but in the 10 million children who have received the vaccine overseas, we haven't seen an increased rate above what we might expect in the population with that particular condition. It's different for the adolescents, and so in the 12 to 18-year-olds we have seen an increased rate of heart problems that's occurred predominantly after the second dose of the Pfizer vaccine, predominantly in young males. And so we know that that is linked to the vaccine. We have really great safety surveillance here in WA, and we are receiving reports on a daily basis of any event that people are concerned about. We're going through those and we're making sure that the right children get seen by a specialist to discuss any concerns that may have arisen.
Okay, and Casey Summers on Facebook has asked, how can we know the benefit of vaccinating kids outweighs the risk, especially when we do know that kids are not as badly affected by COVID-19 as adults, Peter?
Yeah, that's another great question, and obviously that's what we want with all vaccines. We want to know that the benefit is outweighing the risk. The evidence, as I said, is that the vaccine is safe. It appears highly effective, so more than 90% protective against the strains that were circulating at the time of the studies, and probably will be a little bit lower for Omicron, although we don't have that data quite yet. But certainly if we look at adults, then it is providing protection against that new Omicron strain, just at a slightly lower level. What we do know though is that COVID in children, the risk of side effects, including things like pericarditis and myocarditis, is much higher than it is after the vaccination, even in those teenagers and young adult males. So the overall risk-benefit ratio is far in favour of having the vaccine. And as Asha said, although it's usually a mild illness, there are rare complications that can occur, and we do know that in WA we are going to get exposed to a lot of cases of COVID occurring across the community, across all ages, including young children. So we will be seeing some young children ending up in hospital, and that's what we're trying to prevent, as well as just stopping them getting sick, have to have time off school, infecting other people in their family. So there's lots of good reasons why everyone should be getting their children vaccinated, and certainly I have no concerns. And I've also vaccinated my children.
I think there's also, Ali, some more information coming out about the post-infectious illness, which is sometimes called PIMS-TS or MISC, MISC-C, and those are, I guess, events that are new diseases that we didn't know about before COVID, and the vaccine has actually been shown in adolescents to be protective against those post-infectious complications, and they are much more likely for children to end up in ICU or needing hospital level care, albeit they're rare, but when they do occur, they will need hospital level care. And the vaccine has protected both against needing that event occurring, but also against ICU admission for those children. So I think that's some new information that's coming through that demonstrates further why the vaccine matters for this age group.
Can you just explain what those conditions are that you mentioned? Like how does it affect children?
Fantastic question. So it affects children by causing a fever, sometimes lasting for several days, a rash, some, abdominal pain, and even some concerns around the heart being inflamed about 2 to 6 weeks after they've had a COVID infection. And about 1 in 2,500 children may have this occur. And so if we can reduce that number further, then that is really important for that rare event for it to be protected against. So families are, aware that this is happening in the community, but it's, not as well known as, say, the mild illness of COVID in children.
Great, good to know. Javita Nelson on Facebook has asked about the effectiveness of Pfizer. You did cover this, Peter, a second ago when it comes to the Omicron strain, but can you just run us through how effective is the Pfizer vaccine in children when we're dealing with Omicron?
So, as I said, the evidence is we still haven't seen all the information to say exactly how effective it is. What we do know is that children do make high levels of antibody and certainly higher levels than actually older people who have the vaccine. And so we would anticipate that there would be similar benefits. So the particular issue with Omicron is that if you've had your vaccinations a long time ago, so more than 4 months, the protective effect of vaccination does seem to have waned off very quickly, particularly for the Omicron strain, which is why we're recommending boosters for adults, but also increasingly I think we'll be thinking about it for teenagers as well, because they will be now coming up to that 4 months. But the early protection does look good, it's just not quite as high. It's more in the 50 to 70% range than over 90% range. But still protective and importantly, still highly protective against severe disease. And as Asha says, things like the PIMS-DS syndrome and other severe complications, the vaccine continues to protect against that, even if it's not protecting against mild infections.
And one of the things that I know a lot of parents are concerned about is long COVID and what impact that has on a small child if they were to get COVID-19. What do we know about long COVID in kids?
So we do know that long COVID does occur in kids. So this is having ongoing symptoms past 3 months of having the infection, and particularly around fatigue, feeling unwell, this sort of mental fogging that some people, they can't think straight. And these are chronic side effects. The incidence in children, fortunately, does seem to be less common, so maybe 1 in 20 children, 1 in 10 in some studies, but it is a bit variable. And all the evidence, again, predominantly from adults and older children, it looks as though the vaccines do protect that, and we think it's probably because it's helping you get rid of the virus quicker before it has a more general effect on the body. So I think that's why we can be confident that this is also something that you can prevent in children.
Okay. Another common question we've had has been around dosage, Asha, particularly for kids who might be small for their age or large for their age, who are right on that sort of cusp age group for different dosages. Kids obviously getting 1/3 of the dose if they're under 11. Why are the dosages set at that age group and not set by weight or size or anything like that?
Well, I think it's probably a practical reason that that's occurred, because you can study groups of children in age bands, and we often recommend vaccines at particular ages. So it makes sense that they chose ages rather than, weight-based dosing. The interesting thing is that the 5 to 11-year-olds receiving the 10 micrograms of a Pfizer vaccine, which is 1/3 of the adult dose, are still mounting really good antibody responses on par with 16 to 25-year-olds who received the 30 micrograms. So I think if anyone is a little bit concerned, I've got an 11-year-old and a 12-year-old, one's getting the 10 micrograms, one's getting the 30 micrograms. Will one get better protection? Well, the vaccine actually in that lower dose in the 5 to 11-year-olds provides a really good antibody response for that age group. So I think it's when we're trying to design the studies that then inform how we actually deliver a vaccine program, we often need to think about those practical ways in which children congregate. And 5 to 11-year-olds are those primary school age children, and so it makes sense that we think about them as a group rather than, adjusting based on weight. Great.
And Peter, I'll put this question to you because I know you've got expertise in allergies and immunology. Jessica Lawson has asked about allergies. She has a nut allergy and so does her daughter. Jessica said that she had a mild allergic reaction when she had her first vaccine. What do we know about children with anaphylaxis and the COVID vaccine?
So the good news is that both for children and adults who have significant allergies such as peanut allergy and anaphylaxis aren't at increased risk of having anaphylaxis with COVID vaccines. And that's because there's no components that are shared between the COVID vaccine and the food allergens. There are some drugs that can be used that are contained within the vaccines, something called PEG, which is is the fatty coat that goes around the mRNA vaccines, but allergic reactions to that are incredibly rare. So essentially, unless you've had a severe allergic reaction to a previous dose of the COVID vaccine, any sort of allergy is actually not a contraindication.
Great. And if you're watching us on the live stream, please jump on and ask your questions. You can put them in the comments section and we're having them fed to us live. So please do ask any questions you have. The next question comes from Ellen Walker on Facebook. Asha, she's asked, are any antibodies passed on to infants through breast milk if mum is vaccinated after giving birth? And is there some level of protection then given through to the baby through breast milk?
So there's been some really good studies looking at this once again to try and understand whether there's any benefit. And they have been able to detect the antibodies in breast milk, and it's likely that offers that some protection to the infant. We obviously recommend that women who are pregnant right now receive their vaccines, and as soon as possible receive the vaccine during pregnancy, because the risk of COVID is actually much higher for pregnant women than the potential risk of a side effect to the mother during pregnancy from the vaccine. And so if anyone's thinking, I can wait till I'm breastfeeding to receive the vaccine, we'll actually strongly recommend that you get that vaccine as soon as possible, because during pregnancy, particularly as we know that we will have COVID in our state much more widely very soon, we want to make sure that pregnant women are protected. And then if someone has finished their pregnancy, they've got a baby at home and they're breastfeeding and has not been vaccinated, then we strongly recommend that they also get vaccinated, because there will be some benefit to the infant as well.
That's right. And also, of course, if the mum's vaccinated, she can't get infected, then she won't be able to pass it on to a baby. And because of the close contact, it's very likely if a mother's infected, she'll pass it on to a baby. So that's another reason as well.
And that leads us into another question we've just had live. What about herd immunity? Is it better to just let everyone in the family get it and get on with it? And once children have had it, are they immune?
So what we do know is that immunity from infection is not as good as immunity from the vaccine. So that's the first thing to say. So you certainly get better and longer lasting antibodies from the vaccines than you do from the infection. And unfortunately, we've also found that with Omicron, previous infection from the Delta or other strains didn't appear to provide any protection. So that won't be great protection against the next variant that comes along. So we would definitely recommend that you get vaccinated instead of getting an infection. And we do know that herd immunity will be hard to get with this virus, because it's spread so easily before people get sick, and it's harder to get antibodies into the nose to completely neutralise the virus. So that's going to be very difficult for us as a community to get herd immunity. The good news is, though, if you've been vaccinated and then you get infected, you actually get a boost to your immunity. And so that would be a better way because you then have all the benefits of the vaccine without the risk of getting the disease.
And we've just had another follow-up question for you, Asha, about pregnancy and having the vaccine. Are there any potential side effects for the baby when mum is pregnant, or is it just the mum who would have the usual kind of, fever, that sort of thing? Is it perfectly safe for the baby?
From all the studies that have been done, we believe that it's the best thing for women who are pregnant to have the vaccine. There are no definite side effects to the infant for that occurring. We obviously know that the side effects that can occur from a vaccine for a pregnant woman having a high fever can be quite concerning. So making sure that taking paracetamol or ibuprofen and things like that, paracetamol is the better one, sorry, for a pregnant woman, to make sure that fevers are managed is just an important thing to do. But it is safe for women to have that vaccine during pregnancy.
Great. And a Facebook question from Vanessa. Peter, do unvaccinated children transmit COVID at the same rate as adults? Unvaccinated adults.
Unvaccinated adults. Okay, so that's a great question. This is actually a really hard thing to prove. What I can say is that there have been household contact studies that have been done in the context of Omicron. And it has been shown that if you are vaccinated in a household and you're the first person in that household to get sick, you're much less likely to pass it on to the other members of the household than if you haven't been vaccinated. The data we have so far looks as though children and adults probably have about as much virus in their nose as each other. And particularly for Omicron, I think that's still the case. The ideal situation is as many people in the household who can get vaccinated are, and that way you'll be able to protect people who either have problems with their immune system, such as elderly grandparents, or children who are too young to get vaccinated, because you won't be bringing COVID into your household and giving them a big dose of the virus. So that's really what we want to make sure people do.
And another question following on from that's just come through on the Facebook Live comments. Once Omicron is everywhere and children are at school, what can we do to keep it out of the house, obviously, aside from being vaccinated? How do we protect ourselves once it's around in the community, Asha?
I think that's a great question, and we have been practicing this for the last 2 years. And the critical things that we've been talking about all of the time since the pandemic started include continuing to wash your hands regularly, to make sure that your kids are really well versed in how to wash their hands well, and making sure that that's part of your routine to, when you come in from being outside of the home, come in, make sure you wash your hands and things like that, using alcohol gels as well. We also know that face masks are an important consideration, and for those who are comfortable wearing them as children, then it can be an extra layer of protection. I understand though that many kids find them tricky, difficult to do well as it's not an absolute essential. So face masks are another thing that we can consider. Kids, I think, are the best that I've ever seen at catching their coughs and sneezes in their elbow. It's something that they seem to have been taught to do in daycare, and then they teach each other to do, and they do it far better than any of us as adults. So continuing to encourage your kids to not be sneezing on their hands, but to catch their cough in their elbow is a way in which we can reduce that transmission hand to hand, and cleaning our hands as well. We also know staying home when you're unwell is an absolutely essential part of this whole process. And so even now, there are respiratory viruses that circulate beyond COVID. And so when you've got a runny nose, a cough, a sore throat, the best thing possible is to stay home, protect others around you by not going out in the community and spreading it. So those messages continue to be really important. And we also, I guess, have that other social distancing message. We can see we're separated here when we're talking, and trying to stay that 1.5 metres away from other people is really important wherever you can do it. And I get that kids, it's hard to get them to do that. It's part of our mindset and thinking about, well, okay, keeping myself safe, keeping my family safe. These are some things that we can do, and we know that they work.
And kids are so much more adaptable at that stuff than we are sometimes, aren't they? They took to it like ducks to water last time.
I think also as adults we can do everything we can so that we don't get infected and bring it back to the household. So that's the other thing that all families can do as well.
Yeah, good advice. Another common question that we've had through has been about the World Health Organisation's approval for children to have the vaccine. There has been some misinformation around online suggesting that approval has not been given. I understand it was given in December. But Peter, can you just explain what is the WHO's, procedure for giving its approval to these vaccines, and why are they sometimes, out of step with individual countries?
So the World Health Organization has responsibility for health across the world, but particularly for those low and middle income or poorer countries where they may not have access to things like approval agencies such as the TGA, as well as not necessarily being able to afford vaccines for their community. And so what the WHO does is that it actually licenses it in a similar manner to the FDA or the TGA, and looks at the same sort of information and provides that as a, yes, we've looked at it, it's okay to be used in all those countries. For the World Health Organisation, though, at the moment, there's a large amount of the world that is still unvaccinated, particularly high-risk elderly people, healthcare workers, essential care workers, people with chronic medical conditions. And really that's their focus at the moment. So we know children aren't as likely to get infected and have severe disease as those other high-risk groups. So that's their focus at the moment. So they would prefer a vaccine rather than going into a baby in a poor African country to be going into a healthcare worker or an older person or somebody who's got chronic medical conditions. So that's really their focus. And once those people have been vaccinated, then they will look more carefully at getting vaccines for children. And I think they will, and they have approved it. So there's been no regulatory agencies around the world that have looked at the information for COVID vaccines that we're using in Australia and said, you can't use them. So people should be reassured that globally the vaccines we're recommending have been approved in Europe, in North America, in Asia. So we can be confident about the safety of them.
Okay, and this is a question for both of you. You're both clinicians here at the Perth Children's Hospital. What are some of the conversations that you've had with parents about the vaccine that have made you a bit concerned about what the kind of general feeling is out in the community? Is there anything we'll start with you, Peter, anything that's jumped out at you?
Yes, I've had lots of long conversations with people who, because I always ask my patients, are you vaccinated? Is the family vaccinated? Because that's part of good health, and that's the insurance policy that you're providing for yourself, but also for your family. And I think sometimes some of the questions are, yes, well, this hasn't been tested long enough, this hasn't been tested properly. And all we can say is that by a global effort and investment of a serious amount of money actually to do these studies quickly. It's not been a different process, it's just been done much more quickly because so many people have been cooperating to do it all together. So I think that's the first one, that somehow this is a different process. And remember, in Australia, these vaccines are licensed and registered. They're not emergency use authorisation, which people might have heard of, that perhaps doesn't quite have that same level. We have had the opportunity, because of our control of COVID in our country, that we have been able to wait to look at all the data and importantly look at countries overseas giving millions of doses, or now billions of doses, to say, yep, these vaccines are safe and they are effective and they work. So I think that's one. The other one that I've heard about is, but I've heard all these people are dying after they have a vaccine. Well, unfortunately, when you're getting very old and you have lots of medical problems, people do occasionally succumb to those diseases. What we have been doing, and people around the world have been saying, is that related to them having that vaccine or not? And that simply hasn't been the case. What we can say is that it's stopped people dying of COVID and COVID-related complications. And so I think people should be reassured about that. Finally, the other one that I probably get asked most about is, particularly from young women, is about fertility. And should I give it to my teenage daughter? I've heard that it'll interfere with the spike protein that helps you get pregnant when the fetus is implanted. The spike name has been mentioned in both of them. They have nothing to do with each other. So the spike protein in the coronavirus has nothing to do with any proteins in our body. And in fact, in the studies that have been done, a lot of the volunteer women who've been part of it have got pregnant during the study after receiving the vaccine. So we can actually say that the vaccine categorically does not have any impact on fertility.
Asha, what are some of the things you've heard that have concerned you?
To be honest, I think a lot of families just want to run through what are the pros and cons, what are the safety profile, what should I expect, and how can I support my child to get this vaccine? So there's lots and lots of questions, and they really just want to listen to an expert talk about it and reassure them that this is a good decision, because it's new information. It's a vaccine that wasn't part of our schedule for kids ever before, and so families just want reassurance. And I guess, a considered conversation to answer their questions that they specifically have. So I think that's probably a big part of it. And as Peter said, ensuring that not just talking about it for the children, but when we're paediatricians looking after children with chronic medical illnesses, we do want to make sure that their parents and their grandparents and their brothers and sisters are vaccinated as well, because that's another mechanism to help support them to prevent them from getting sick. So having conversations with families about the importance of vaccination, checking in on their regular schedule and making sure that they've also received those vaccines that are strongly recommended for childhood, and then having sort of a really open conversation about why we're doing this, what the potential risks are of it, what the benefits are, and how we've acquired all of that information so quickly. And Peter and my job is really much about keeping abreast of a lot of information that's just coming continuously, and we've prioritised looking at the stuff for children and making sure that we're as knowledgeable as possible about studies going on all over the globe. As soon as that information comes out, making sure we're aware of it and we can use that to inform our decision making.
Great. So for those of you who are watching the live stream from Western Australia, you'll be well aware that our borders are due to open on February the 5th, and of course school kids go back to school on January the 31st. So Asha, a question for you. Given that no primary school children in WA will have had double dose vaccine by the time they go back to school, is it safe for classes to continue when the borders open?
I think this is a really great question, and the premise is that every school day matters, and that every school day matters for educational outcomes, for long-term benefits from being at school, as well as the social and emotional impacts of being at school. So we think it's really important that our schools do open on the 31st of January, and as many children as possible who can receive the vaccine prior to that will do so. Now, we know that this is a 2-dose schedule. And we know that there needs to be the first dose and then the second dose given before we are able to say you've got good protection against COVID. So our kids will be returning to school with having had the first dose and not necessarily having had the second dose yet. I still think that they've got that extra layer of the first dose of protection, and during first term will receive that. And probably around the time when our borders do open on the 5th of February, we'll see a slow increase in the number of cases. Watching what's happened over East, I think between 4 and 6 weeks is probably when we'll start to see much more widespread community transmission, and by that point a lot of the children will be ready for their second dose. So I think it is a really important thing that we prioritise our kids being in school and learning in school. Also need to be really respectful of the school staff, the teachers, the admin support staff, the principals who are planning for our schools to get back on the 31st of January, and making sure that they've all had their vaccines and had their boosters to ensure that there's as little chance possible of transmission occurring in the school environment. And continuing to reinforce the hand washing messages, thinking about the way in which we gather, and making sure we're following all of the public health messaging that comes throughout our state.
And Peter, I understand there's an 8-week wait for kids under 11 between having first dose and second dose. For adults with Pfizer, it's only 3 weeks.
Yeah,
why is that extra time in between first and second dose for kids, and would there be a case to move it closer together?
So I guess the first thing to say, so the studies with the vaccine initially in children were actually done 3 weeks apart. So we do know that the vaccine does work in children if it is given with a shorter interval. And in fact, it is recommended for children who are particularly at risk, those with problems with their immune system and other chronic conditions, that they can have it early. The reason why we've chosen as a country to do it 8 weeks apart is because the evidence has accumulated in both adults and some emerging evidence in teenagers that actually separating those 2 doses by 8 weeks actually gives you better longer term protection. So the antibodies the immune system's sort of been better trained by that first dose, so by the time you give the second dose, you not only get a higher antibody level, you probably also get a better spread of antibodies that will help you protect against variants such as Omicron. So I think that's why we've chosen to do it. There may be a situation where we have to look at reducing that interval, and I guess we're going to have to see where it goes. The good thing about children, though, is that that first dose does give you, as Asha said, some protection, particularly against severe disease. So I think parents should be reassured that whilst it is a bit longer and that some may be a bit worrying a bit about waiting that time and what's going to happen. I'm confident that it will be safe, but I think this might be something we'll have to see what happens in WA as things emerge and be agile enough to change our policy if we need to. And the good thing, we know that it works if we do have to give it a bit sooner.
Good. Asha, this is one for you. We've had a lot of parents of kids under the age of 5 get in touch and say, firstly, what can I do to protect my child, particularly if they're in a daycare setting, and we know that there's a lot of, sharing and that sort of stuff that goes on at daycare, but also when will that age group potentially be able to be vaccinated?
Really top questions. We know there are vaccine trials going on at the moment for the 2 to 4 year old group and then 6 months to 2 years, and we expect that those will report in the next few months. So I think we will be having a conversation about toddlers and children under 5 very soon as to when a vaccine becomes available for them, but none of that data has been released to public as yet, so we just don't have that information to share easily. So it does come down to children in daycare continuing to make sure that everything that we can do in terms of hand washing, in terms of daycare kids are actually really good at catching their coughs in their elbows because they've been well trained, and keeping your children home when they're unwell with coughs, colds and sniffles. I know how hard that is as a mum, say that lightly, but it really is an important thing that we need to do to make sure that when kids are at daycare, they're less likely to spread it amongst others. And once again, daycare staff being vaccinated, making sure that they're as fully protected as possible, and parents and grandparents being vaccinated and doing all of the things that we know work to prevent them from getting COVID and bringing it home. So wearing your mask when you're asked to do so, making sure that you are paying attention to hand washing, social distancing and following all the public health measures.
Yeah, and I guess the other thing is also just remembering to get tested if you do have symptoms that could be COVID. So that'll be important, and hopefully we'll get more rapid antigen tests that will become available soon for people in the community. But until then, go and see your local doctor or COVID clinic where you can get tested.
Another question that's come through from our Facebook Live audience is about going to crowded places like shopping centres post February 5. Would you take your young kids to a shopping centre or a play centre or an indoor swimming pool post February 5? What's your advice?
Those are great questions. Kids are part of families and they have to go with their parents, so it's not safe to leave your child at home to go to the shopping centre. But I think as a mum, shopping online is a blessing because taking your toddler to the shopping centre is hard work. So I think, that's a totally outside of COVID kind of consideration. But I think trying to think about who else will be there, what sort of contacts there might be, training your children not to touch things at the shopping centre. I still have that conversation with my 9 and 10-year-olds. Maybe we don't need to touch that handle right now. Maybe we'll clean our hands. There's alcohol gels, lots of different places, and really continuing to have those conversations. Play centres and indoor swimming pools, I think, are part of children's life and wellbeing. Right now, we've got perfect weather to be outdoors. So outdoor pools are probably a preference, and outdoor spaces are probably better for congregating because we know that the transmission of respiratory viruses is less likely when you're in an outdoor space. So those are probably better places to choose. But as we progress into the winter months, we will want to keep our kids' swimming lessons going. And once again, we live in a state where we've got great access to waterways and we want our children to be safe in the water. So it's trying to balance all of the things that you need to be thinking about as a parent. It's not only COVID. We need to make sure that we have safety as a priority for our children, and water safety is just as important. So swimming lessons are a high priority. So don't want people to stop doing those things, but also just thinking about ways in which cleaning your hands as you're going in, making sure you're using the check-in so that contact tracers can get in touch with you if they need to, and thinking about, how essential is this activity today? Are there alternatives? Those kind of considerations need to come into our thinking now.
I think as well, it's also, Peter, COVID's here to stay to some extent, and we need to just get used to living as normal a possible life with it while being safe.
Yeah, absolutely. I think we have to get on with living and not get too frightened of living in a community where there's COVID, because, as you say, this is going to hang around. And I think, we can also think about wearing masks. Even younger children, if training them to wear their mask, like they can be trained to cough into their elbow. So that'll be something, if you are going somewhere where you think, oh, okay, I'm going to be stuck on a busy train, maybe that would be a good thing that they could do as well. So that might be starting to have those conversations. There's nothing magic about being 12 and not being able to wear a mask younger than that. It's just that it's hard for them to keep it on. But not only does it protect you against COVID, against all these other respiratory viruses that we see bringing children into hospital. So I think that is something we probably are going to have to get used to, having masks with us and wearing them when we're in indoor spaces with other people.
Great. A question about boosters, Peter, which I'll put to you because you're about to launch a nationwide study on boosters for adults.
That's correct.
But what about boosters for kids? Are they likely? Are we going to be having boosters every year?
Yeah, that's a great question. I think it is likely that we will be having boosters for children. I think the evidence from the studies so far is that we do certainly get a better response to that third dose of the vaccine that we receive. And I think that's consistent with a lot of the other vaccines we currently use, where we also find that sort of booster at 6 months gives you optimal, better long-term protection. So I think that will be coming, and there already are boosters being given to children from 12 to 18 in overseas countries. So we will be thinking about that here in Australia. So particularly once we're about 4 to 5 months after that and there is COVID. I think the other thing is that we will be having new vaccines, new boosters that will be specific for the new variants. So there are vaccines being developed for Beta, for Delta, for Omicron, so they will become available. So I think it's likely that we'll probably want to choose, because Omicron is so different to the current vaccines we're using, that we probably will want to have that specific vaccine, a bit like we have with the flu where we change it every year. What we don't know though is that once we've had 3 or 4 doses, that might last for 2 years, and if we don't have major changes in our variants, then maybe we won't need to have it every year, but maybe we will. Unfortunately, we just don't know that, but we need to be prepared and we need to do the studies to do that. So that's really why we're trying to set up this platform for evaluating boosters as they become available, new vaccines, and work out when we need to give them. So that's going to be really important information. So you'll have to listen to this space, I guess, in a few months' time and see where we're at.
And we've just had a follow-up from someone on Facebook. Would it be better to just wait until there is an Omicron-specific vaccine for kids?
No, because you are not protected. And we know that, as Asha said, these vaccines protect you against those severe complications. So you don't want to take that risk with your children. They're very valuable. We want to look after them. So the best thing you can do as a parent is getting them vaccinated when it's available.
We're getting to the end of our time now. So just to wrap up, Asha, I'll just ask both of you this question. What is one thing that you would like parents to know and to go away with when it comes to the COVID-19 vaccines for their kids? What's the one message you'd like them to take home?
Oh, that's a good question. Really that this is available to us and to our community and to our kids, and it's a really important vaccine to protect your child from the small chance but real chance that they could get very unwell with this virus. And so we really do want to recommend that every parent goes out and gets their 5 to 11-year-old vaccinated, and if you haven't had your teenager vaccinated as yet, please also take them.
Yeah, I think Asha and I are aligned with this. You know, as somebody who's been working in this field doing research for 30 years, you know, we are really lucky that we have such a great set of vaccines that work in everyone who we're using them in, that are safe, have very limited side effects that are very rare, and even when they do occur, such as the pericarditis, that it seems to go away very quickly. And COVID is such a tricky disease that has caused so many people to become unwell and die, you know, and we have something to prevent it. So, you know, make the most of this opportunity. Vaccinate everyone in your family who can be vaccinated. Have your boosters when they're recommended. Don't delay them, waiting for a better option to come around. And we can, as a community, if we do that, and it's fantastic, 95% of eligible Western Australians over 12 have received their first dose of a COVID vaccine. So people are really switching on to this. So let's be part of the solution and protect our whole community.
Professor Peter Richmond and Associate Professor Asha Bowen, thank you so much for your time today and your very valuable insights. For everybody watching on Facebook, thank you so much for your questions, both before the event and during the live event. We'll have the full version of this event available on our Facebook page immediately after this broadcast. Thanks.